Hi parents and potential parents, no doubt you are the pioneers of human experience. Welcome to our talk on Attention Deficit Hyperactivity Disorder, in short ADHD Part 1. What is ADHD? It is a neurodevelopmental condition known as Attention Deficit Hyperactivity Disorder ADHD. It often affects children, but can also linger into adolescence and adulthood. It can impede day-to-day functioning and growth because of its enduring patterns of impulsivity, hyperactivity, and inattention. Besides medical intervention, role of parents, teachers, and the society has a vital role in treating or mitigating the effects of this disorder. It is therefore imperative that we have substantial knowledge about the disorder and the role to be played by the parents, teachers, and society towards supporting ADHD patients. Part 2 Types of ADHD. 3 types. First, inattentive presentation. Children with inattentive presentation frequently have trouble maintaining focus, planning, and following through. They could come across as easily distracted, forgetful, and incapable of finishing jobs or following directions. Second, hyperactive impulsive presentation. It is characterized by impulsive conduct, restlessness, excessive physical activity, and trouble waiting one's turn. Youngsters with this presentation might talk back to other people, find it difficult to stay motionless, and make snap decisions. Third, combined presentation. It is characterized by a mix of hyperactive impulsive and inattentive symptoms. It is the most typical way that ADHD manifests. The symptoms must be widespread, persistent, and severely hinder social, intellectual, or professional functioning for ADHD to be diagnosed. Typically, symptoms start before the age of 12, and they must persist for at least 6 months for numerous symptoms to be present. Although the precise etiology of ADHD is unknown, many neurological, environmental, and genetic factors are thought to have a role in its development. Behavioral therapies, psychoeducation, and occasionally medication is used as treatment options to assist control symptoms and enhance functioning. Part 3 Contributing factors. First, genetic factors. The onset of ADHD is significantly influenced by genetic factors. Research on twins and family history has repeatedly demonstrated a hereditary element, meaning that a family history of ADHD increases the likelihood of developing the illness. Certain genes associated with dopamine receptors, neurotransmitter modulation, and other neurodevelopmental processes have been linked. It is critical to remember that while genetics may increase a person's vulnerability to ADHD, environmental circumstances also play a significant part in determining the condition's existence. Second, environmental factors. Varied reasons, including low birth weight, lead exposure, substance exposure during pregnancy, and psychosocial stressors can influence the development of ADHS. Problems during pregnancy, early birth, maternal smoking, and alcohol use during pregnancy have been associated with an increased risk. Additionally, early exposure to environmental toxins like lead, which can affect brain development, has been linked to ADHD. Psychosocial factors, including family dynamics, parenting styles, and socioeconomic status, may also influence the expression and severity of ADHD symptoms. Third, neurological factors. Deviations or anomalies in the structure and function of the brain are considered neurological variables that play a role in ADHD. Studies using neuroimaging have revealed changes in the size and activity of specific brain regions, including those related to executive, impulse control, and attention. Frequently implicated are the dopaminergic system, basal ganglia, and prefrontal brain. Disproportions in neurotransmitters, especially those pertaining to dopamine and norepinephrine, influence attention regulation and impulsive control. Even though these neurological variations are linked to ADHD, research is still ongoing to determine the precise relationship between brain structure and function and the onset of ADHD. Part for support from parents and teachers. while it might not be able to stop attention deficit hyperactivity disorder ADHD from developing, there are a few tactics that educators and parents can use to foster a supportive atmosphere that could lessen the likelihood that children would experience ADHD symptoms or at least lessen their severity. Number 1. Early intervention. It might be important to recognize and address such problems as soon as possible. Indicators of behavioral issues, attention, and impulse control issues, or developmental delays should alert parents and educators. Speech, occupational, or behavioral therapies are examples of early intervention programs that can be helpful. Number 2. Healthy parental environment. It is essential to maintain a healthy parental environment. Alcohol use, drug usage, and smoking should be avoided by expectant mothers. Having a healthy diet, controlling stress, and receiving enough prenatal care contributes to a healthier developmental environment for the unborn child. Number 3. Organized and predictable routines. Children benefit from organized and predictable routines, particularly those who are at risk for ADHD. Regular daily routines at home and at school can give kids a sense of security and support with organization and focus. Number 4. Positive parenting techniques. Fostering positive parenting techniques can help create a welcoming atmosphere. This entails laying forth precise guidelines, employing constructive criticism, and establishing suitable limits. A child's emotional growth and well-being can be enhanced by consistent and loving parenting. Number 5. Physical activity. Studies show that regular physical activity enhances attention and cognitive performance. Children should be encouraged to participate in age-appropriate physical activities by both parents and teachers. These activities can help control hyperactivity and enhance general well-being. Number 6. Offer balanced nutrition. Both general health and brain function depend on a diet that is well-balanced. Parents and educators are responsible for ensuring their children eat a diet rich in critical nutrients, such as omega-3 fatty acids, which promote cognitive development. Number 7. Monitor and limit screen time. Adequate screen time is linked to attention and behavioral problems, particularly in young children. It is important for parents and educators to keep an eye on screen time and set limits. Encouraging a healthy balance between technology use and other activities. Number 8. Encourage collaboration and communication. It is essential that parents and teachers communicate openly. Communicating worries and observations can help identify a child who is having problems early on and provide the right kind of care. The efficacy of treatments in the classroom and at home is increased by collaborative efforts. It is critical to recognize that, despite the supportive environment these techniques help to create, ADHD is a complex neurodevelopmental illness influenced by neurological, environmental, and hereditary variables. For kids who consistently struggle with hyperactivity, impulsivity, or attention, getting an evaluation and guidance from a professional is essential. Part V. Role of society dealing with ADHD patients. The promotion of awareness, provision of assistance, and creation of inclusive environments are critical. Functions of society in the betterment of children with ADHD. The following are some ways society can get involved. By adopting these strategies, society may actively help foster a welcoming and encouraging atmosphere for kids with ADHD, enabling them to realize their full potential and engage completely in all facets of life. Number 1. Promote awareness and understanding. There is a need for society to do more to raise people's knowledge and comprehension of ADHD. Information on the condition, its difficulties, and the abilities that people with ADHD frequently possess are all part of this. A community that is more supportive is fostered by educating people about stigma reduction. Number 2. Inclusive education. Educational establishments such as schools can adopt inclusive methods to cater to the various requirements of kids with ADHD. This could entail training teachers on efficient methods for handling ADHD in the classroom. as well as individualized lesson plans and extra resources for support. Number 3. Anti-bullying campaigns. Kids with ADHD may have trouble interacting with others and may be more vulnerable to bullying. The community can help schools and towns implement anti-bullying programs to establish safe spaces where every child can grow. Number 4. Community support programs. It can be helpful to set up community services and programs for families whose children have ADHD. This can entail access to workshops, support groups, and mental health specialists who specialize in ADHD. Number 5. Healthcare support. Affordable and easily available mental health care should be provided, including the diagnosis and treatment of ADHD patients. Improving access to mental health services enables families to receive the assistance they require for their kids. Number 6. Job accommodations. As children with ADHD become adults, the community can help by advocating for job modifications. It is possible to educate employers about ADHD and motivate them. To offer a supportive work environment by modifying tasks or offering flexible schedules. Number 7. Media campaign. Promoting truthful and uplifting depictions of ADHD in the media is important. This can help dispel myths and stereotypes while highlighting the abilities and skills that people with ADHD frequently possess. Number 8. Parenting guidance networks. Encourage the development of parenting networks and services that offer guidance and assistance to parents whose children have ADHD. Talking about your experiences and getting advice from others might help you get through the difficulties of parenting an ADHD child. Number 9. Lobbying for policy reforms. Promote laws that assist people with ADHD and their families. This covers regulations pertaining to healthcare, education, and workplace accommodations. People with ADHD benefit from a friendly legal environment in general. Number 10. Encourage patience and empathy. Promote a culture that is patient and empathic with those who have ADHD. Promote acceptance and understanding in communities, schools, and families. By highlighting the special talents that people with ADHD offer to society. Part 6. Medical intervention. By reducing symptoms and enhancing cognitive abilities, medical intervention drugs like stimulants and non-stimulants can effectively treat attention deficit hyperactivity disorder ADHD. When it comes to treating the neurobiological aspects of ADHD, drugs can be a key component of a comprehensive management strategy. Even though behavioral therapy and support are still important, medical therapies have a significant role in symptom control for many ADHD sufferers, enabling greater focus, impulse control, and general functioning. Nonetheless, the most successful method often combines behavioral, medicinal, and educational techniques customized to the patient's unique requirements. For the most current and region-specific information on the availability and effectiveness of medical support for ADHD, it is advisable to consult with healthcare professionals or relevant healthcare authorities in your area. It is crucial to pay timely attention towards identification, mitigation, and treatment of ADHD patients. In summary, meeting the requirements of a kid diagnosed with ADHD requires a multimodal strategy that includes cooperation, support, and understanding. It is critical to acknowledge the special talents and difficulties these kids face, and to promote a supportive and welcoming environment in families, schools, and communities. Children with ADHD can benefit from a combination of behavioral techniques, educational interventions, and, when necessary, medicinal support to enhance their general success and well-being. Through raising awareness, lowering stigma, and supporting inclusive legislation, society can make a significant contribution to enabling these people to live happy, fulfilled lives and realize their full potential. The journey of a child with ADHD is a team effort that calls for tolerance, understanding, and a dedication to creating a setting that values differences and encourages everyone for a unique journey towards growth and success. If you find this video to have useful information, offer it a go ahead. Hit the subscribe button and share it with your companions. Until some time later, look after your little loved ones and remain tuned for additional interesting investigations here on our channel. Thanks for being with us. Take care.